Mental health awareness is an important issue for all educators. The Substance Abuse and Mental Health Service Administration says educators are often the first to notice a problem in students.
The National Alliance for Mental Illness says 1 in 6 youth ages 6 to 17 experience a mental health disorder each year, and half of all mental health conditions begin by age 14. Since children spend much of their time in school, educational settings offer an opportunity for early identification, prevention, and intervention.
We reveal the ways teachers are working to address your child's mental health and the resources available for parents whose child may be struggling. Richmond, Virginia high school student Chase Evans knows the stress that can come from the classroom.
I mostly focus on what my friends might need and what my peers are wanting because it can feel very lonely.
It's one of the reasons she tries to support friends and peers through her high school's Speak Up Club. It focuses on mental health, education, volunteering, and taking part in a 5K to raise awareness for teen mental health.
Sometimes those reaching out can really change your perspective.
Reaching out and talking are exactly what prevention specialist Devin Alvin hopes kids will do.
Children are far more willing to talk about mental health and things that they're struggling with than any generation in the past has ever been.
She helped implement the Hope Squad in the Medina County, Ohio school system to address student mental health. The Hope Squad is a specific student team trained to listen to their peers and know what to do in a crisis.
Being able to empower them to not only have the conversations but know how to manage them wisely is really what we're trying to do.
The National Alliance on Mental Health, or NAMI, echoes Devin. NAMI says schools can play an important role. Gail Hawk is part of an outreach team to help families who've lost someone to suicide. She says school staff can learn to identify the warning signs of an emerging mental health condition and how to connect someone with care.
Well, one of the things that we've learned is that we can't wait too long. We've got to start earlier in the schools, and we have to not wait until high school. We need to be in the elementary, the middle schools. So I think those prevention efforts need to start very early on.
According to a 2022 article from Harvard University, when students experience depression or anxiety, it affects their mood, energy level, and ability to concentrate. The Substance Abuse and Mental Health Services Association recommends that educators learn more about mental health by taking training to help ensure a positive, safe school environment. SAMHSA also suggests schools teach and reinforce positive behaviors in decision-making and encourage students to help others. It's something Chase Evans is already doing with her classmates. She wants them to know it's okay to talk about not being okay.
Being able to ask for help and being able to be vulnerable and being able to say, I'm not doing okay, will you talk to me, whether that's a friend or whether that's medical help, from a doctor of some kind.
The Centers for Disease Control and Prevention found the same strategies that promote mental health, like helping students feel connected to school and family, help prevent a range of negative experiences like drug use and violence. The CDC also says strong bonds and relationships with adults and friends at school, at home, and in the community provide youth with a sense of connectedness.